Good evening, everyone. Thank you so much for joining us. My name is Vivian Hahn. I use she, her pronouns, and I am a senior policy attorney at Disability Rights California. I am also a sibling. I have a brother who has a disability and is served by the regional center system. Next slide, please. So, uh, I'll give you a quick overview of what we will be talking about tonight. We're here to talk about the California state budget. As you might have heard, California is facing a significant budget deficit of about $12 billion for the next fiscal year. And that year starts in July 2025 and runs through June 2026. So, to address this, the state government has decided to make some changes to try to fill that budget gap. And a number of those changes will affect Medi-Cal and IHSS, or in-home supportive services, for certain groups of Californians. So tonight we will talk more about how these decisions are being made. How is this being decided and by whom? We'll learn a little bit more about the budget process. Where are we in this process? What do we know and what don't we know yet as of today? Whom would these changes affect most and how? And lastly, what's next in the state budget process? And what are some things that we can do about it? Next slide. So, how is all of this being decided and by whom? Who is making many of the proposals that you might have heard about floating around? To be very clear about the state budget process, it is unique, and some of you may be familiar with the legislative process that happens when bills get introduced into the legislature and eventually signed or vetoed by the governor. The budget process is a different and completely separate process that works differently. So, to make a long story short, the proposals that and changes that we're talking about tonight are based on proposals that the governor made in May, so just last month. A few weeks later in June, the legislature, after reviewing the governor's proposal, came out and stated their position on those proposals. They came out and said what they thought, where they agreed with the governor, and where they disagreed. So, who gets to make the final decisions about the budget and about which proposed cuts or changes go through? Those final decisions are done through negotiations between the governor and the legislature, specifically the leadership of the Assembly and the Senate. And those final negotiations are done behind closed doors, without public hearings and with little transparency to the public. Now, there are budget hearings that take place before those final negotiations and after the final negotiations. So we do get to hear a little bit there, but by and large, the final decisions are made privately between the legislature and the governor's administration. That's where the decisions are ultimately made. And this year, the budget process took a long time, longer than in most years. But finally, just a few days ago, on June 24th, 2025, we learned that the legislature and governor had finally reached a budget deal. So they announced that they came to an agreement on the budget, and that is something we will be going over tonight as well. Next slide. So first, we wanted to give you an overview of where we are in the budget process. So we put a star on this graphic to represent where we are. And the state budget process actually goes year round, and it starts all the way back in January, where the governor proposes an early draft of the state budget. Then in May, by May 14th, the governor has to revise that draft budget based on the latest estimates of state revenues, or basically much better, more accurate estimates of how much money the state of California will have. By June 15th, just about a month later, the California Constitution requires that the legislature has to pass a budget bill that is based on the governor's May revision. So that's not a lot of time. It's just a few weeks for there to be a lot of discussion about the governor's final budget proposals. And by July 1st, the governor has to act on the budget bill that the legislature passed. He can sign it, he can veto it entirely, or he could veto some parts and approve other parts. But that needs to be in place before the new fiscal year starts on July 1st. And in July and beyond, specifics, meaning lots of details about what all the budget changes might mean, how they'll work on the ground, a lot of those are actually not included in the budget bill. They are fleshed out later in bills that come out afterwards. They are typically called trailer bills because they trail after the original budget bill. And the budget bill is very minimal. It really just contains the appropriations, meaning the dollar amounts that are allocated to different things. Then there's a brief description of what each budget amount is for. And that's pretty much it. There are many, many details about how all of this will work that are left until later. And that's what comes out in trailer bill language. If some of those changes require changes to the law, you'll find those in trailer bill. And if later in the summer, they realize that they actually need to change some of the numbers or some of those original descriptions, those changes are done through what are called budget bill juniors. And those will come out over the summer. Next slide. So, what do we know and what do we not know as of today? So, what we have known for a while are the cuts or changes that the governor proposed. And we know that in May, he did propose a number of changes that were very, very concerning to many people with disabilities and their families, because many of the proposals would have had significant impacts on Medi-Cal, on IHSS, and other supports that disabled people rely on. We also know what the legislature thought of those proposals because earlier in June, they came out with statements that made very clear which of those cuts the legislature wanted to agree to, change, or reject entirely. We did not know for a long time where all of this would end up, but fortunately, as we mentioned on Tuesday, the final budget deal was announced, and we now know the agreement and the compromise that they reached between their two positions. So now we know which cuts are going through, and we also know if they were changed, and if so, how. So again, more details will be on the way. The complete budget deal, as I mentioned, will be contained in pieces in a number of different bills. And on the slide, we've included, again, just brief definitions of these different types of bills so that as they come out, You can go to the Ledge Info website that the California legislature maintains, and that could help you identify and look for those bills that will have more details. Next slide, please. And with that, I will turn it over to our next speaker.
Thank you very much, Vivian. Good evening, everyone. Thank you again for joining us. My name is Anna Leach-Proffer. I am the managing attorney for the Healthcare and Home and Community-Based Services Practice Group here at Disability Rights California. I use she, her pronouns, and for a quick visual description, middle-aged white woman with light brown hair. I am wearing a blue shirt and I have a blue DRC logo background. So this evening, I'm going to talk to you about some policy changes to the In-Home Supportive Services Program. We'll refer to that as IHSS, and the Medi-Cal programs that were included in this year's budget. So I'm going to talk both about proposals that did not end up going forward that you may have heard about, and also those that will become policy changes. Um, as Vivian mentioned, we just got this information a couple of days ago. Overall, there were many positive changes from what the governor's proposal had originally been, resulted in less cuts than we had feared, thanks to strong work from a number of advocate groups, including DRC and members of the communities we serve. So just as a quick summary, so there were, I'll give a quick overview here of the types of cuts that were proposed. There were proposed cuts in a number of areas, including lowering of the cap on IHSS provider hours, lowering the limit to 50 hours per week. There's a proposal to eliminate IHSS for anyone with unsatisfactory immigration status, proposal to reinstate the Medi-Cal asset limit, and to eliminate the use of the IHSS residual program, to allow a grace period for people to maintain their IHSS when they lose Medi-Cal. There are also several limitations on Medi-Cal eligibility and access to services for individuals with unsatisfactory immigration status that were proposed in the budget. So we could move to the next slide, please. Okay, so first I'll talk about the proposal to limit the number of hours that an IHSS provider can work to 50 hours per week. This was a proposal that DRC and many people in the communities that we serve were extremely concerned about because of the devastating impact it could have had both on the availability of care for IHSS recipients and the ability of their providers to earn a living wage. So the good news is that this will not be happening. So I know it's been, out there a lot of people talking about this. So we wanted to make sure to stress that this proposal will not be moving forward. We have really strong opposition to this. Um, the current limits on IHSS work weeks will still apply, but there will be no changes to the current overtime rules. There will also be no changes to the current overtime exemption process, which allows providers to provide up to 360 hours per month or roughly 12 hours per day when certain criteria are met. So basically, in summary, getting this proposal out of the final budget was a huge victory, and one that we are really pleased about. Next slide. So I'm going to move next to another similar proposal that would have impacted access to IHSS that I'm very happy to report did not become a policy change in the final budget. The governor's budget had proposed to eliminate IHSS and other long-term care services for individuals without satisfactory immigration status. That would have also eliminated access to skilled nursing facilities and other long-term services and supports. And this proposal, again, one that DRC and others in the advocate community and communities we serve were strongly against. It would have taken away services from people with disabilities who are currently receiving IHSS and resulted in a risk of institutionalization. Again, very pleased that this proposal did not make it into the final budget at all. So there will be no changes to availability of IHSS for individuals with unsatisfactory immigration status who currently have Medi-Cal and are receiving those services. Move on to the next slide, please. Okay, so the next change I want to talk about was a proposed policy change to the Medi-Cal asset limit. So just for a little bit of background, the Medi-Cal eligibility programs that are based on disability or age, which include the Aged and Disabled Federal Poverty Level Program and the Medically Needy Program, have historically had very strict asset limits of only $2,000 for a single person or $3,000 for a couple. Those asset limits were in place until 2022 and had not been changed for more than 20 years. So the assets included in that calculation would be things like bank accounts, cash, a second vehicle, a second home, or investment accounts. So there was an exemption for one car and one home. In 2022, that asset limit was raised significantly to $130,000 for a single person and $195,000 for a couple. And then in 2024, last year, the asset limit was totally removed. Next slide, please. So the governor's initial proposal in the May revise would have returned the asset limit to the pre-2022 levels of $2,000 and $3,000. So we are pleased to report again, there was a lot of advocacy done by DRC and others on this proposal that, while we would have, of course, preferred not to have the asset limit return at all, the governor did agree to a compromise position where we will be returning to the 2022 level of $130,000 for a single person, 195 for a couple. So this is a change that, while unwanted, at least is far less bad than moving back to the extremely strict and unreasonable $2,000 limit. So this should allow families to have a second car and to accumulate some emergency savings without forcing unreasonably strict limits. So again, overall, pleased with that compromise position. Okay, next slide. Okay, so this next one is about a proposal that also did not become a policy change. It's a little bit complicated of a proposal, so I won't get into great details about this, but basically there's a current policy that allows for a grace period where someone's IHSS services, which are a Medi-Cal benefit, will continue for a few months, up to 6 months after they have lost their Medi-Cal eligibility. And that's paid for and allowed by a program that's called the IHSS Residual Program. And what that does is it basically ensures that people don't lose the IHSS services necessary to keep them, living safely in their homes as a result of administrative errors or delays in processing their Medi-Cal renewal that are not their fault. Um, so the governor's budget had proposed eliminating the use of the IHSS residual program, which would have meant people would lose their IHSS the day they got, a Medi-Cal termination. But that we're again pleased to report that that proposal did not move forward. So people will still have a brief grace period to allow them to correct a wrongful Medi-Cal termination and not lose their IHSS and have to start all over with a new application and all those types of things that could result in the loss of established care providers. And then next slide, please. So in our final slide on the changes here, we're going to talk about a few proposals that DRC and the advocate community broadly opposed, but unfortunately did become policy changes. For the most part, they were the eventual change that was approved was less bad than the one in the governor's proposed May revision, but still changes that will have a negative impact. So the first is that the freeze on new Medi-Cal enrollments for people aged 19 and over with unsatisfactory immigration status that was delayed from the original start date, which would have been basically immediately on July 1st, to a start date on January 1st, 2026. Um, so what this does, it does not impact people who currently have Medi-Cal, but it will limit new enrollments starting January 1st, 2026. So it's very important that we and others in the community encourage as many people as possible to enroll before that deadline. One positive change that came through the negotiation with the legislature on this proposal is that um, there will be a 3-month grace period where anyone who has with unsatisfactory immigration status who currently has full scope Medi-Cal, if they lose it for any reason, could be just delays in submitting redetermination paperwork or delays from the county, they will have up to 3 months to re-enroll without being locked out as a result of the freeze. So in the original proposal, an individual would have been immediately locked out if they lost coverage for any reason and would not have been able to re-enroll. So this at least creates a 9-month period for somebody to get any issues corrected and re-enroll in Medi-Cal without being locked out. The second change is the implementation of a $30 per month premium payment for individuals with unsatisfactory immigration status. The good news, if you will, on this is that the original proposal start date has been pushed back. So as of now, this will start and this will be effective July 1st, 2027. The governor had proposed a $100 per month premium. And so while DRC and many others opposed any premium as unfair and discriminatory, there's some bit of good news in that there has at least been a delay in the implementation and a significant lowering in the amount of the monthly premium. The final change I wanted to mention is the elimination of dental benefits for the entire population of Medi-Cal enrollees with unsatisfactory immigration status. That will start July 1st, 2026. Dental is an optional service for Medicaid plans, so it is historically an area where services have been cut in lean budget years, including, there were cuts in 2009, 2010, impacted the entire Medi-Cal program. So dental coverage is something that sort of some benefits have been taken away and brought back. So not necessarily a surprise that that's a benefit that's being removed, but again, it was disappointing that while we did get a lot of good news, we also, there are some cuts that will have a significant impact we'll need to be sort of looking for ways to mitigate going forward. Okay, so now I'm going to turn it over to my colleague Bumit to wrap up our presentation before we move on to our Q&A time.
Good evening, everyone. My name is Bumit Rai. I work on the intake and outreach team, so I take a lot of calls from my callers and families and want to educate them on their rights. So, what can we do to be proactive to avoid some of these new changes that are coming down from the budget agreement? So many of us may want to look into options that may already be available. One of them would be CalAble. Right now, if you're disabled before the age of 26, you can open an ABLE account to pay for qualified disability related expenses. So if you need something like dental care, a person can use money in the ABLE account to pay for expenses, and you can have up to $100,000 in the ABLE account and still qualify for SSI, and you can have even more money if you just Medi-Cal. Starting next year, um, you will be able to open an ABLE account if you're disabled before the age of 46. So it gives a lot more people access to these services. Um, and an ABLE account is very easy to open. One can open an account. The minimum requirement $25, and you can get a prepaid debit card to pay for expenses at the store, fill up gas, anything related to a disability. So that's one option we may want to look into if we want to protect our assets from program requirements. The next program that many people don't know about is the 250% working disabled program. It will allow people to work and be on Medi-Cal so they can have a higher income limit until qualify for Medi-Cal. In 2025, for an individual, a income limit is around $3,200, and for a couple, it's around $4,400. The active limit of the 130,000 for an individual and 195 for a couple still apply for that program. The cool thing about this program, anything can be considered work as long as you do it on a recurring basis and have some documentation of you performing a activity. And to apply for this program, we recommend contacting your local county Medi-Cal office. the last thing I want to talk about is petrol need trust. So many individuals get a large sum of money and they're like, I can't take this money because it will disqualify me from the programs that I need to remain independent. If you get a large sum of money, you may want to look into a petrol need trust where you can put that money into account where the individual with the disability does not control the money, but the money is used for the individual to pay for expenses that public benefits do not cover. So all the tools are used are available to people and we should all look into them and you can contact disability rights if you have any questions about the program. Next slide, please. I'm going to pass it back over to Vivian, who's going to wrap it up.
Thank you, Bumi, for those suggestions. So now to finish, we will talk about what will happen next. It's a very good question because this is a very unusual year. So for right now, as I mentioned earlier, what will happen is that a number of bills are starting to come out, and a number of them have come out already. There will likely be some more trailer bills that come out over the next couple of weeks. Um, and I am sorry that the budget comes out in this very scattered way in many small pieces instead of in one big, neat document, but that is how our state budget works. So again, if you have questions about, for example, definitions, what does a particular term mean? Or what are the rules about how some of this will work? Often those answers will be in what we call trailer bills. And that's language that implements the policy changes that are necessary to make the changes in the state budget. And generally speaking, anything in a trailer bill, those changes take effect on July 1st. So pretty much right away that same year, unless it specifically states otherwise in the trailer bill. So that is what is happening right now and will be happening for the next few weeks. What will happen after that? We're not really sure. What we do know is that the budget that was just passed was based on California's assumption that federal Medicaid funding would stay about the same or close to the same as it has in the past. But we know that that may change soon because of what is happening at the federal level. We know that right now, Congress is taking a very close look at some proposals that would make significant changes to Medicaid, which would mean significant changes and likely possible reductions to the amount of federal Medicaid dollars that go to the states, including to California, for health and human services. And that's a big deal because currently federal Medicaid funding makes up anywhere from a third to about a half of the total budget for California's health and human services programs, depending on which program you're talking about. So if the amount of that funding decreases or is changed significantly, that could force California and other states to have to revisit or reconsider what they can provide. In other words, it may force the governor to propose further budget cuts, unfortunately. Um, that is a possibility. We don't know for sure. A lot depends on what happens at the federal level with Medicaid funding. But I did want to note for everyone that although the news that we got out of the budget deal this week was more or less good news for the most part, um, it's not over yet. If it turns out that the state needs to make further adjustments to the budget because of what might happen with federal funding in August or September, that's when the governor would need to propose further budget cuts again, and then a smaller version of this process would start over again. The legislature would take a look at the governor's proposed cuts, and it would be up to the legislature to push back on them, suggest alternatives, or propose possible compromises or a middle ground. And those negotiations would take place again in August or September. It's unusual. That usually does not take place in most years, but as we all know, this is not a regular year. So uh, stay tuned. Next slide. And I will turn it over to Harvey for some information before we go to questions. Thank you.
Hello again, everyone. We will now begin the question and answer portion of our town hall. First, let me go ahead and issue some accessibility reminders for participants. If you would like to ask a question, you can either click on the raise your hand button, which is nested under the reactions feature at the bottom or the top of your screen, or type your question into the question and answer feature at the bottom or top of your screen. That's the little square with the question mark in it. The telephone shortcuts, if you don't have access to the Zoom video controls and you're calling in by telephone, you can use *9 to raise your hand. You'll also need to be waiting to be called on if you have a question, and you'll use *6 to mute and unmute. Shortcut for Windows users is Alt-Y to raise and lower your hand, and for Mac, it's Option-Y to raise and lower your hand. And lastly, a couple reminders for those asking questions live. Speak clearly and at a measured pace. Please take a pause while speaking, and especially after and in between saying your name or company name. And then saying the full name of something instead of using acronyms is helpful. And if you'd like to sign your question in ASL, please first let us know in the chat so we can set you up for that. And then we'll go ahead and allow you to turn your video on. Thanks.
Thank you, Harvey. Good evening, everyone. My name is Sabrina Epstein. I use she, her pronouns, and I'm going to be facilitating the Q&A tonight with a wonderful panel of experts. For a brief visual description, I am a white woman with short curly hair and glasses, and I'm in front of a DRC background with a pride flag. I'm going to alternate between the Q&A and the attendees with hands raised, so I will try my best to get to everyone. And to start, I am going to ask a process-related question from the Q&A, which is, just a second. Who proposed these bills? Was it Governor Newsom? And I think Vivian can answer that one.
Yes, happy to. So the short answer is yes. It was the governor and his administration who first proposed these cuts. Now, I doubt it was entirely the governor himself. I am sure he had help from others in his administration, his staff, also the heads and the leadership of all the different departments within his administration. Also, I'm sure had input. But yes, the proposals originated and in the budget process, they always originate from the governor and his administration. And then the legislature's role is to push back, question, criticize, disagree, or come up with other solutions. And then the two sides negotiate and kind of work out a compromise or deal between their two positions. That's how the budget process works. So yes, it is the governor who came up with these initial ideas.
So next, I'm going to read a few of the answers to questions that came in through Q&A. We have some wonderful colleagues who are answering them live. There were several questions that I think I can just summarize by asking about IHSS changes that were not final. They were rejected. And so your IHSS overtime or your protective supervision or other exemptions that you may have in your IHSS should not be changing this upcoming year. And that was thanks to the hard work of many advocates, especially people with lived experience. The next question that I'm going to raise is, do those who register with UIS, which means unsatisfactory immigration status, risk having their information shared with DHS at the federal level, as this information was being shared and a flood of applicants could put people at risk? Is there any work being done to protect this data? I am going to share a resource in the chat that I hope will answer that question, but if any of my colleagues want to add to it, but I think the answer is we do not know what the risk is, and we are very concerned and continue to monitor it closely.
Yes, it's an excellent question. We had the same question and we have engaged with and reached out to the departments. To their credit, they were very alarmed by this and they are taking this very seriously, but unfortunately, the answer right now is that we don't know. I do believe that the departments and agencies and the administration all recognize how critical it is to keep that information confidential, and I believe they have stated they have no intent to share anything inappropriately. But in terms of how that would work or what might happen in the future, I don't think we know have been given those details yet.
Thank you. The next question is there a way that we can get more caregivers slash caretakers, such as offering higher wages or more work hours? The limitations are harming people, especially those who are forced to live alone, in order to be eligible for government assistance. And then they go on to talk about how living in a facility is harmful and is far from their family.
Yeah, I can take that question, Vivian. I think this is a hard one and certainly an ongoing issue that DRC has been involved in a number of ways. So, we have done advocacy pretty consistently over the years to help increase the pay rates for IHSS providers. We have tried and unfortunately failed at various times to push forward proposals that would allow for higher rates in sort of difficult to serve areas where there are provider shortages, including rural areas. And also we've, pushed in the past for higher rates for paramedical and other more complex IHSS services, where often it's, harder to find a provider willing to meet those needs. This was certainly a concern that was top of our minds when we were fighting against the 50-hour work week limit, because I think that it is certainly the availability of overtime at time and a half for any number of IHSS hours per week over 40 that allows, people to find providers at all. So we wanted to ensure that the availability of the overtime pay um, was still there. I think, one thing on an individual basis, for somebody struggling to find a provider at the IHSS rates, please reach out to Disability Rights California. We can help connect you with local independent living centers, many of which have matching services available to help people find IHSS, other personal care services providers. So I think we have historically done and will continue to do advocacy to increase the rates and hopefully increase the availability of providers, but we know that it is an ongoing struggle.
Thank you, Anna. The next question that I'm going to take is from one of our Spanish-speaking attendees and says, what's the best way to convince my assembly member to protect my rights? So if anyone wants to comment on what was effective advocacy in this moment and what it'll look like going forward, because there were a lot of advocacy wins here that are worth recognizing.
I can speak a little bit to that. It's such a great question. And in terms of protecting rights, my goodness, there's so many different ways to potentially connect with your assembly member or your state senator. I will just start with the budget advocacy process, since that is our focus tonight. It's not always easy to figure out how to get connected with your assembly member or their staff. But there are a few ways to do it. One is that you can always reach out directly to their offices, and there are different websites and places we can go to look up their contact information. I identify who your assembly member or state senator is if you are not sure whose district you live in, and reach out and say specifically that you are concerned about the budget and you're specifically concerned about a particular proposal. However, there are other more specific things you can do. It's always helpful to reach out to your own assembly member or state senators, because they always, I think, appreciate very much hearing from their own constituents. However, for the budget process, it is the budget committee members, particularly the budget committee chairs, that have the most power and the most authority over the positions that the legislature ultimately takes regarding the budget and what goes through. So what you can do is look up online who are the members of the budget committees in the Assembly and the Senate, and who are the chairs of those committees. Also, in both the Assembly and the Senate, there are budget subcommittees. And this is often where members of the community can have the most impact, because the subcommittees are smaller and they're divided up by topic. So for example, for many of the, in fact, all of the issues that we talked about tonight, In the Senate, there is a subcommittee devoted specifically to health and human services issues. That's Senate Subcommittee, Budget Subcommittee number 3 on health and human services. They have hearings on the budget proposals throughout the spring. That is one place where you can tune in or go to Sacramento and to listen in on debate and to have your voice heard. Um, and consultants are also available to be reached out to if you have a story to share or other advocacy. Finally, if you are interested in doing this kind of thing, you can always reach out to us at DRC. We would love to hear from you. And there are many other organizations and allies that we have in this space who do budget advocacy as well, and it might getting involved with them and their efforts is also one way you can help. And for example, this year we had a letter template online that made it easy for folks in the community to have their voices heard on the budget proposals. That was a letter where you could go to our website and type in your information to sign your name to a statement expressing concern. So those are just some of the ways you can get involved.
Thank you, Vivian. We have a phone number ending in 4150 that I am going to. Oh, one of the hosts has to unmute, please. Okay, you should be able to speak now. Okay, I'll loop back to you. I'm going to take another question from the Q&A. The next question that I'm going to take is this person says, I am a self-advocate and a former benefits advocate. Can consumers file for a state fair hearing if IHSS is eliminated or reduced under the Olmstead ruling? And Anna, do you want to take that one?
Yes, I can take that one. So I guess two answers to that question. I mean, the clear answer, yes, if someone's IHSS services are reduced, they can file for a fair hearing. There should not be any reductions to IHSS as a result of these policy changes in this budget, so it shouldn't happen. The answer is a little bit more complicated when the like if cuts were to have gone forward, eliminating the availability of IHSS for the population with unsatisfactory immigration status. I won't get into great detail, but there's a possibility that that case is going to be sort of outside of the ability or jurisdiction of an ALJ to decide. So that would need to be filed as a different type of case because you're losing the services as a result of a change in the law, not as a result of any action by the county. But the good news is there shouldn't be any changes to IHSS as a result of this budget.
Thanks, Anna.
Mhm.
Okay, if the caller wants to unmute, you can press *6 to unmute. Okay, I think they put their hand down. So I'm going to keep taking questions from the Q&A. The next one is specific to the budget process, which says, what are the revenue sources that decreased in order for the governor to balance the budget with the recommended cuts? Vivian, do you want to take that one? What changed that allowed the governor to have a different version of the budget now?
Sorry, I needed to unmute. In terms of what changed, so was the question about what changed to allow like the budget deal to move forward, essentially? No?
I'm not sure. So answer it that way if you
Okay.
want.
Um, Really, so the governor, I think, proposed a lot of cuts that went a lot farther and would have really had a pretty significantly negative impact on services for disabled people. And they went really far. The fact that the changes that ended up going through were a lot less harmful than what was originally proposed, I think really comes down to the negotiations between the legislature and the governor. So it's not so much that the circumstances changed significantly over the last month to 6 weeks that the legislature and governor have been negotiating over this. I think what changed or what happened, especially around IHSS, was that many people spoke up. Disabled people, their family members, union members, and many people saw these proposals for what they were, which were proposals that would have been devastating to many people with some of the most complex and intensive needs. And so they spoke up and really created a lot of public pressure. So I think that is what made the difference for right now. And we are very grateful to everyone who did raise their voice because we made a difference together.
Thank you, Vivian. So next I'm going to take another question from the Q&A, but in the meantime, can we figure out how to unmute the person who's 7261 who has their hand raised so they can go next? So the next question is, are there any efforts being made to expand the 250% working disabled program in California? We are majorly behind and 250% is not a living wage. Anna, you want to help with that one?
Happy to. There have been in past years, sort of currently and directly, no, but there are other proposals that would have sort of a similar effect. There have been some proposals out there which we have supported, but due to the budget climate this year didn't really make it anywhere that would have basically created effectively like a buy-in program, which some states have, which would allow individuals with disabilities who have incomes. Some states do different levels. At 400% of the federal poverty level is one that I think we saw in I think it was New Hampshire or Connecticut. So there we have been supportive of trying to get a program that would, create a way for individuals with disabilities who are working to have higher income and still buy in through likely a relatively small monthly premium to allow access to services like IHSS. So it's certainly something DRC supports and has been involved in efforts to implement over the years, but not something we directly have a bill or a proposal that we're working on right now.
Thank you, Anna.
Mhm.
Okay, the person whose phone is 7261, you can unmute by pressing *6 and ask your question.
Okay. My name is Veronica Reed.
Yes,
I would
hello.
like to ask a few questions. I don't know if I understood the gentleman that was saying something about there's a new program that people 46 and over that are disabled are going to be able to receive some kind of help.
So the program is called CalAble, and Bhumi, do you want to repeat what it is again?
Yeah, the Cal Able is a program allows people with disability to save
Mm-hmm.
money and not be able to be penalized for saving money. In 2026, people that are disabled before the age of 46 can open a Cal Able account. Right now, the law says people 26 or under are able to open the account. But starting next year, the law is going to expand to a lot more people so you can save money and use that money for disability related expenses. And that money will not count towards SSI or medical eligibility.
Perfect summary. Thank you, Bhumi.
One more question. Does your legal status matter?
I do not know the answer to that. Does your immigration status matter for a CalAble account?
Yes.
Do any of my colleagues know the answer? Well, Vivian put the information in the chat, and I'm going to direct you there to calable.ca.gov, and you can get all the information there. I know there's a couple other questions about it, and
Okay.
we are not all experts on CalAble, so thank you, Bhumi, gave a great summary of it, and I think the website is the best resource for more information. Thanks so much for your
Oh,
questions.
thank you.
Okay, if the person whose phone number is 4150 wants to unmute and ask a question, go ahead.
Okay, I have a question. Who is the person who say there are a couple they can receive the money?
Can you say that again?
There are a couple they can receive the money.
If you are a couple and you have an asset limit tied to your Medicaid, there's a higher asset limit for you. Does that answer your question?
Yeah.
Yeah, for a household of two people, there's a higher asset limit. So it's 130,000 is for an individual. Thank you.
Okay.
So next, we have one more person who's got a hand raised who has not gotten a chance to unmute. Can someone help me? Yes, thank you. If your phone number ends in 91, you should be able to unmute. Go for it.
Hello, my name is Valerie Weiner, and I guess I have a friend who's worried that she's going to be spending a lot of money. Medi-Cal is spending a lot of money for expensive medications, and she's worried about that being cut off. I'm wondering, is it true that are you saying that, I want to confirm that I understand that the state budget's fine, but the federal government could lower things, how much money California gets, and that could lower things and change everything, including IHSS, or is that just Medi-Cal?
Yeah, thanks for your question. So Vivian, do you want to start with that one?
I'm happy to share it with you, Sabrina. But maybe why don't I start, and Sabrina, you can wrap it up. So yes, so I like to think of it in terms of health and human services in California or in any state. There's really two sources of funding: state dollars and federal dollars. So I think of it as like if you imagine a mom and dad who are split up and they're not married and they have a child, right? And both of them contribute money to expenses for raising a child. If one of the parents then all of a sudden decided that they were no longer going to contribute as much money, then unfortunately, right, so let's say it's the dad and the child lives with the mom, then the mom would right, then the total amount of money for that child would just be a lot less, and the mom would be forced to make some painful choices about what they can afford and what they could no longer afford. And that's kind of what is happening with Health and Human Services, because states and the federal government have shared those costs for a very long time. They both chip in dollars. Now that we have a federal government that is seriously considering reducing the amount of federal dollars for health services and social services that the state administers and operates, that will mean, if that happens, that the state will have a lot less funding overall to work with. So, Sabrina, is there anything you want to add?
Yeah, so I am actually going to kind of throw it to a couple other questions we got, and this is, I think, the perfect way to wrap up. So thank you for that thoughtful question. We also got some questions that say, what else can we do at this time? And do you still suggest that we all contact our US Congress? And like Vivian said, we're really worried about Medicaid cuts coming from Congress because we know that this year California had, in the big scheme of things, a pretty small deficit. And even with that small amount of money, they still tried to cut from the services that we need. So if that deficit were to get even bigger, if California were to be missing more money, then it's pretty likely that they would try to cut our services even more. So we need to tell Congress that that's not okay. Congress is actively considering massive cuts to Medicaid, the biggest in history. And so, as someone put in the chat, we need to start contacting our senators. They represent us in Congress. Yes, your representatives and senators do. And if you are concerned about this, that is where I would like to direct your advocacy right now. So, the state budget process will continue going forward. And someone asked as well, are we able to advocate for or protest the trailer bills? I think the trailer bills are probably not something that you can have too much input on now, but there's many other bills in the state legislature that you can weigh in on. And of course, in Congress, that is a really important place to direct your advocacy right now. Because if Congress passes cuts, then all of these cuts could be on the table again in the state. And we are hoping to avoid that. So I think that answered everyone's questions. It's 7:13 and we are going to wrap up. Thank you all so much. The slides are going to be posted in English and Spanish. There are some links in the chat that will be shared afterwards as well. And we will continue to keep you updated on this process. Bhumi, did you want to add something? I see you came on camera.
No.
Or Anna, anyone else want to share any last words?
I was just coming on to thank everyone for the great questions and great discussion before we wrapped up.
Yeah, thank you, everyone. And I hope folks can see that their voice was heard here and will use that as inspiration to continue raising your voice on these issues because we need all of your advocacy, especially folks with disabilities and family members and those who care about them. Our stories are really what made a difference this time in avoiding some of the worst cuts. And let's hope we can do it again and avoid worse things to come. So thank you, everyone, for taking the time this evening to join us and to learn about this. Have a good night.